Good morning, Jorge. Thank you so much for being with us
Good
today.
morning.
We are asking you, or we're going to be asking you some questions about yourself, about the Latino caucus,
Great.
because we'd like to share that with our audience. Can you share with us, about yourself, what you do, and your role with the Latino caucus?
Sure. My name is Jorge Belmonte. As part of the Latino Caucus for Public Health, I'm the social media co-chair, so I communicate with other boards and the communications committee to make sure that everything that we're doing, our vision, our mission, and all of our campaigns are being put out on our social media to get people more aware of what we're doing and what we have been doing for the 40 plus years now. And so getting everybody involved in the in-person campaigns within the community and also on social media.
Amazing. So tell us how you got involved in public health.
I got involved really early on. I think my last semester in college, I took one public health course and I fell in love with it. Everything that we can do from policy to community to the individual level. So I fell in love with it that way, and then you did my research, and then just got more involved in that sense in terms of like getting a higher education. So then I went to Loma Linda specifically for public health and health education. So I've been actively involved more personally with obesity prevention, behavior modification for people trying to change their lifestyles.
Wow, that's amazing. For those who don't know what public health is exactly, because when people hear health, they think about doctors and nurses
Right.
in hospitals. What is public health? How different is that from a hospital or a doctor visit?
I think it just goes more into the personal needs of communities and their health. So, for example, like a lot of Latino communities don't know what resources they may have within their community, and if they don't, it would be part of our job as public health professionals to be able to give them that access and that information. So, not to say that doctors aren't personable and that they don't care about their patients, but through public health, we're able to get more in touch with community needs and help them allocate resources from the bottom down. So getting the community involved themselves in their own sustainability for health, I think is very powerful to get them active in their communities as well. So we bridge the gap between all of the what we would probably consider institutional or organizational background of the policies to the individual level and work together.
Well, that sounds great. It sounds very interesting. So it sounds like public health is more group oriented, community oriented, and then you guys work along with doctors, nurses, and hospital.
Yes, collaboration would be a great way to explain that. Like you mentioned, going doctors and also the community level and everything in between down to the individual person.
Amazing. So the Latino caucus and the Latino community, what is the work the Latino caucus is doing? How does that impact the Latino communities in the U.S.?
Well, because a lot of Latino communities, and I speak for myself as well, parents want us to get a higher education, and then having the resources to be able to continue to pursue those careers, those higher education careers. I believe the Latino caucus plays a huge role in that, where we can get the younger professionals in touch with members of our caucus that have been around for 20, 30, 40 plus years to get them mentorship and understanding how then they can take what they have learned in school to actually apply it into the real life situations. So I think the Latino caucus really helps bridge that gap of getting people involved, growing campaigns to make sure that we're actually doing and setting out to what our mission statement is and our vision, which is to help and advocate for our local communities in the Latino populations.
Great. And I know you mentioned that you work with obesity, health styles, and nutrition. Is that a big issue in the Latino community, and what are some of the issues that impact the Latino community in terms of the health or the health status?
Yeah, I mean, in terms of lifestyle activities for our Latino communities, I think a big factor in improving health individually and in the community is just being able to have a conversation about their weight and certain issues like type 2 diabetes, cholesterol, blood pressure, and reducing the barriers that come from like the social environment of our Latino communities, where they might, a lot of it is food oriented, and the food is great and it tastes amazing, but just having the concepts of simple things like portion control, and then going out for a walk and not getting too acclimated to a sedentary lifestyle, and have it more family approach to their health and eating healthier, as opposed to just trying to do it completely on their own.
Fantastic. So for our audience, what would be your message? What will be the the takeouts from the conversation we have in here, that you would like to make sure that they listen to this conversation and said, yes, this is important. What would that message be?
I think the message is get involved. Right? There's a lot that you can do in the field of public health, and there's a lot of different organizations that are more than happy and willing to collaborate to help, with health equity, healthcare access, individual things like obesity prevention. So there's a lot of work to do in the public health space. So just getting involved and like joining, memberships like the Latino Caucus will really help you get active and involved and do what you say that you want to do to improve community health, if not global health.
Great. Thank you so much, Jorge, for sharing with us. It's really exciting to see, what you and the Latino Caucus is doing for the Latino community in the U.S. Thank you very much.
Thank you very much.